Whether you're possibly using illegals or the safe and sane fireworks, we have plenty of dangers of fireworks that you need to know about. 11 people across the country died last year from fireworks-related injuries. So joining us in studio with more on what he sees here at our local trauma center every year, we have Dr. David Bowen, a board-certified hand and plastic surgeon at Kern Medical. Thank you for joining us.
Thank you very much.
So we were just talking in the commercial break. This is the third time we've done this interview where you talk about, unfortunately, very gruesome local injuries that you see. But last year was a little different. Tell us why.
Yeah, as I was saying at the break, 5-6 years ago, we saw 5 to 6 devastating hand injuries every 4th of July. And I was like, what can I do about this? And your network was so gracious to have us on. And I was thinking, well, I'm really not talking to the demographic that's blowing their hands up because they're usually young kids. But their parents were obviously listening because last year we didn't have a single loss of digit or devastating hand injury. And that was the first 4th of July, probably in the last 6-7 years that's occurred.
That is just fantastic. And of course, we want to keep that trend going. So it's not just as simple as you lit a firework that was bad. Sometimes it's improper use. When you get those injuries coming in, what are most of the stories you're hearing of why it happened?
Well, 3 things really. These fireworks are unpredictable, unreliable, and unregulated, and they have devastating consequences. And most of these injuries occur when a firework is lit, it doesn't go off, and the person goes and picks it up. And what do they pick it up with? Their dominant hand. And then it goes off. So now they've incurred a devastating injury to their dominant hand, and their life will never be the same after that. Despite all the best efforts we can give them, it's a permanent injury in most of these cases with devastating consequences.
Just heartbreaking. So we have some video from the fire department in the past showing the dangers of holding sparklers, how fast you can have a firework explode if it's put inside of a watermelon, like right here. Imagine your hand is around that. So let's say, heaven forbid, like we see on TV, somebody loses a finger. Do you put it on ice and bring it to you at Kern Medical?
Well, you know, in the ideal world, yes, that would be nice. But the problem is the mechanism of injury of these is blasting of all the soft tissues, and replanting these digits is virtually impossible. So we tend to try to stabilize the patient, reconstruct what we can, and then that patient's looking at sometimes years of further operations, therapy, and other modalities to try to give them their hand function back. The take-home message really is don't handle fireworks. Even sparklers can burn you. They look innocuous, but they're not. And it's best left to the professionals. And I want to make sure that the 4th of July is memorable for all the right reasons and not all the wrong reasons.
So perfectly said. And then one final note from you as a surgeon and as a doctor. Say someone does get a minor burn. How do we treat that at home this 4th of July?
Well, the best thing to do is ice it, elevate it, ibuprofen for pain, and get to the emergency room if you're really concerned.
Okay. Doctor, thank you so much. We appreciate it.
Thank you.
And let's keep that trend going. No more emergency room visits. We'd appreciate that.